What are the differences between COVID-19, the common cold, and influenza? Hi, it's Dr. Bill here. I'm the Director of Health and Wellbeing at the University of New South Wales, and I wanted to answer some of the more frequently asked questions about COVID-19. So the answer to this question is not that easy. Unfortunately, in many young people, symptoms which are similar to the common cold can be caused by COVID-19. That's why we're now asking all people in New South Wales with any respiratory symptoms, which might be a runny nose or a sore throat, leading up to high fever, cough, and even shortness of breath, everybody should get tested. Having said that, the flu and COVID-19 illness can be very similar in that you can get a fever, you can get a bad cough, a dry cough, feel quite unwell, and almost be bedridden sometimes with the fever and aches and pains with both COVID-19 and influenza. Now, the difference in timing is that the influenza illness tends to hit you pretty hard fairly early on. So in the first couple of days, you'll probably be feeling those symptoms, whereas COVID-19 can develop over a period of a few days, but still the main symptoms are often very similar. The main difference with the common cold and COVID-19 is that mostly with COVID-19, if you have a significant illness, you won't have much of a runny nose, you won't be sneezing a lot, and you may well have a fever, whereas a fever is quite unusual with a common cold. Having said that, it's important to make sure that if you become ill in any way with a fever or a respiratory infection, that you do get yourself tested. And before you get yourself tested, make sure that you isolate yourself, wear a mask when you're near anybody else, and look after yourself by drinking lots of fluid, resting, and taking some paracetamol for fever or aches and pains.